there is a culture shift happening in pharmacy as well too, where I think that, a lot of light has been shed with local boards of pharmacy around workplace conditions and the challenges that are happening there. I think tremendous light is being shed. I think you sent me that article yesterday with the oversight committee on PBMs and what's happening there. There's more spotlight on PBM reform and what's happening. I've heard more in the last 2 years since Rutledge versus PCMA and what's happening there, what happened there in the PBM reform and what's happening. And so people are becoming more and more aware. Now, the sad part is it's not happening fast enough for it to impact making sure that independent community pharmacies don't close their doors. But how do we do the other things? How do we engage in other pieces that the business model isn't just based on prescriptions, right? They're not based on a product. And so that's where I feel like in the communities, we have to deliver care locally. We have to be able to be not just a pharmacy, like a dispensing hub. We have to be a healthcare hub. We have to be a center of healthcare excellence for these patients. So we have to engage in a multitude of ways to care for these patients. And, when you look at it across the board, a lot of these patients are looking for support. They're looking for opportunities. We just haven't had the time to ask them. We're asking them so many other things. We're addressing their medication needs. But and what's cool about the program that I mentioned earlier, Will, with Health Game Plan and PPC at Home, I was introduced to a concept called the 4Ms, and it's a model with which when we're working with this patient population, we're looking at four things: mobility, medication, mentation or their functional capacity, and the last M is a trick. It's what matters, right? So what matters to the patient? So many times we've got these patients coming in and, you have small talk and you're talking with them and you jump right into your consultation points to ensure they have what they need and whatever. Are we asking these patients, or are we addressing what matters to these patients? And I think that right there is the greatest opportunity for independent community pharmacies. If we can address what matters to that patient, what are their challenges? What are their barriers? What are the social determinants of health that they're experiencing? It doesn't matter what the other entities are doing, whether they're closing down or doing whatever. That patient becomes a patient for life because you're addressing things that really nobody else in the healthcare ecosystem has.
Yeah, what's a win for that patient? If you can tap into an individual patient's value system, there you go.
Absolutely. And so, it's a simple concept. The model is a simple concept, but when you start to practice it, right, when the doctor tells you to go exercise, you hear, okay, I need to go. I probably should walk a few thousand steps a day, or I need to get on elliptical or whatever. We hear it, but where independent community pharmacies can really thrive, and why I'm really excited about not only just the offerings of CPSN, but what we're doing at Avant and PPC at Home, is that we're able to engage patients in ways that they need to be held accountable, right? They're looking for accountability. They're looking for that support, right? And they go to primary care thinking they're going to get that, but primary care is just so busy. There's too many patients for them to do that. So unless they're in a particular program or in a particular plan, they're not getting that regular follow-up. And we all know, all independent pharmacies know the statistics, right? You're seeing that primary care doc 2 to 3, maybe 4 times a year. You're in your pharmacy 8, 9, 10, 11, 12 times a month. Year, just the touch points that can happen. So how do we capitalize on that, right? How do we engage? And now, how do we utilize the resources that we have, right? Leveraging technology, leveraging what COVID has kind of done, right? And patients are used to actually having care at home, right? They couldn't get to hospitals. So where did they turn to? They couldn't get to the hospital. They came to their local pharmacy, or we were delivering to their homes. We were giving vaccines in their homes and whatever it might be. We were creating clinic opportunities for them to do these things. So that to me is the opportunity for pharmacies it is unfortunate that these pharmacies are shutting down. And I do feel bad for the pharmacists and the staff that are a part of these entities, right?
Yeah, of
But,
course.
where one door closes, another one should open. And it's not like there aren't other opportunities on the horizon. We spent the last 50 minutes now talking about all of these other things. So I would hope that, there are opportunities for those pharmacies to look to see how to engage in these different things. And I would probably imagine that a lot of independent community pharmacies are looking for help, right?
Yeah, with that influx of patients.
Yeah, you're looking for
Yeah.
help. So why not, reach out and see who are the folks that fit your culture, that fit the environment that you've built and can help support you in that way. And I think that, it is unfortunate that these things are happening. And I think we're going to see a lot more of that. Unfortunately, I think that the kind of the business model and the infrastructure for these bigger entities is probably going to lend to that. But if I'm an independent community pharmacy owner, how do I now prepare my pharmacy to be ready for those challenges and for this influx that's potentially there?